Assalamualaikum and good day, students. I'll be continuing on the last part of the lecture. I will discuss about the transfusion-transmitted infection. Transfusion-transmitted infection can be due to many causes. They can be due to viruses, bacteria, rickettsia, or protozoa. For viruses, we have various viruses such as hepatitis virus, retrovirus such as HIV, herpes virus such as CMV, cytomegalovirus, parvovirus B19. For bacteria, we have Treponema pallidum, Borrelia burgdorferi, Brucella, Yersinia, Staph, and also Pseudomonas. We also have rickettsia and also protozoa. So there are many emerging diseases that we're not sure whether it can be transmitted through transfusion or not. That's why before we decide to transfuse a patient, all the complications need to be considered. I will be discussing about the bacterial contamination, which is actually the most common microbiological complication of the transfusion medicine. In some books, they were also called as transfusion-related sepsis or septic transfusion reaction. This bacterial contamination has higher incidence in platelet concentrate, especially near the expiry date, because the platelet concentrate is stored at the room temperature, which is a very good temperature for the bacteria or for the microbes to grow. Where are the source of contamination? We have three major causes of contamination. One is from the donor. That's why before we want to take the blood from the donors, we need to make sure that we clean the skin of the donors very well. And also the second one comes from the contamination of the bags of packs during manufacturing. And the third one is contamination during collection, processing, and storage. That's why in the blood bank, we need to take care of the sterility during collection, processing, and also storage to make sure we will reduce the risk of contamination of the blood product. What are the signs and symptoms of this bacterial contamination? Usually, there will be a rapid onset of fever, usually very high fever, more than 2 degrees Celsius. And the patient also will develop chills and rigors. At the same time, sometimes patient will complain of abdominal cramping, nausea, and also vomiting. In severe cases, patient can have hypotension and also shock. And in very severe one, the patient will presented as disseminated intravascular coagulation or DIC. Okay, the investigation are actually similar to what we need to do if the patient is suspected of having acute hemolytic transfusion reaction, because the signs and symptoms are about the same. But on top of that, we need to add in few specific investigation to exclude bacterial contamination such as blood culture, gram stain, and also we need to inform the blood center because probably that donor has repeatedly donated blood. So we need to hold whatever the blood or the blood product coming from that donors to be given to other patients.